All right, welcome back everyone. So this will be the last section that we do, and then at the end um, I'll leave a few minutes for any additional questions, and then we'll do the survey at the end as well. But now, we've focused on remember that we're focusing on the collection of data now, and we just looked at some sampling plans, and now we're into observational studies and experiments. And so I know that this is probably review for a lot of you, but I think it's helpful to go back through some of the study design characteristics. And if it's not review, that's great as well. But it helps us remember the importance of this idea of confounding variables and how different observational studies are from experiments, and then the types of conclusions we can make from them. So we're just going to do some different definitions, go through a couple of different study designs, and then move on into statistical inference and some different things there as well. Okay, so let's just look. A lot of times, instead of just wanting to identify, say, a parameter of interest, say, like what proportion of people think this or agree with this statement, we're really interested in public health often in looking at relationships between variables. And a lot of times we want to know in public health modifiable variables that can be associated with different health outcomes. And so, for example, the big question many years ago was, does smoking cause lung cancer? Do higher levels of air pollution cause a higher death rate in people infected with COVID-19? There's been some research on those associations. Can diet reduce the likelihood of coronary heart disease? Do the COVID-19 vaccines based on mRNA mechanisms prevent the spread of disease? So a lot of these questions are really indicating that this question of like, can we say that changing one variable can cause a change in likely outcome in another variable? And that cause and effect relationship can be very tricky. And there are a number of reasons for that. But let's start with observational studies and look at what an observational study is. An observational study is just like it sounds, right? A researcher simply observes objects or people as they are without any manipulation on a variable. Okay, so for example, smoking and lung cancer studies are observational. We just simply observe whether a person smokes or not, or how much they smoke, and then observe, record whether or not they develop lung cancer. Or a lot of times we'll have what they're called retrospective studies, and we might have a database of health outcomes, and then we might somehow look back into their past through health records or questionnaires to ask them, had they smoked in the past? Okay. Or for another example, maybe we want to know if language development of young children is different if they attend a large daycare versus a small daycare, or a certain daycare that uses some type of educational curriculum as opposed to a different type of daycare or preschool. So if we think about explanatory and response variables, we would be in terms of the item number one, or the variable that we would hope to manipulate if we could, the explanatory variable in item one would be smoking. The response variable would then be whether or not they develop cancer, lung cancer. In item two, the explanatory variable would be the type of daycare or the curriculum being used. And the outcome would then be language development, maybe some type of numeric measure, maybe some categorical measure. Okay, that table that I showed you at the beginning of our course looked at the different types. That random sample of all the different types of all of the different research articles, the 200 plus research articles. And they found that 82% of those that they sampled were based on observational studies. And, you know, it's because the observational studies are often the only way that we can get this information, even though we would prefer data that can come from an experiment. The observational studies are usually the only option that we have for a number of reasons. But also because a lot of times it's just not, it's not possible, or not, it's just not even feasible to say, to assign people to different groups if they're potentially detrimental to their health, such as smoking. We can't, you know, actually control which people smoke and which people do not. And that is why so many of these studies of different, you know, carcinogens or other types of things that could negatively affect health have to be observational, because we can't, you know, we can't implement things like that in an experiment. But in an experiment, the beauty of the gold standard experiment is that a researcher can assign subjects to different treatments, and so that the only difference in those different people, if they are randomly assigned to treatment groups, the only, you know, measurable difference between those people, since all of those the random differences would be balanced out through the two treatment groups, the only potential difference is the treatment itself. And therefore, if there's a difference in health outcome, that difference should be attributed to the treatment itself. So we talked about this cardiovascular experiment where they're looking at the effect of Mediterranean diet on cardiovascular health outcomes. So they had 7,447 participants with high cardiovascular risk, and they assigned them to one of 3 diets randomly. So Mediterranean diet supplemented with olive oil, B, Mediterranean diet supplemented with nuts, or C, a control diet, just advice to reduce dietary fat, but not the Mediterranean diet. Okay, and so out of the control diet, there were 109 people with cardiovascular events. But then out of the Mediterranean diet, with nuts, there were 83, and the Mediterranean diet with olive oil, there were 96. And so the big question is, you know, are those differences big enough to say that they're statistically different, or could they just be due to random fluctuation, like in our sampling distributions? So we'll look at that in a little bit. But the take home here is that if we do decide there's a difference between these groups, that since they were assigned to these treatments, and they should be equal, these treatment groups should be equal across all other, like, you know, all of these other types of variables such as gender, race, age, and so on, then the only true difference should be the diet itself between these groups, and therefore we can attribute these cardiovascular events to the diet, or the reduction in cardiovascular events to the diet. So why, the whole reason why we care about an experiment is because of confounding variables. So here's a great fun example of someone decided to put together for a bunch of different countries. On the x-axis, so now we get to put our scatter plot knowledge to use here. On the x-axis, we have chocolate consumption of these countries in kilograms per year per capita. And then on the y-axis, we have the number of Nobel laureates per 10 million in population. So we see as chocolate consumption increases, the Nobel laureates is increasing. And so, you know, we see there's this strong association. So one would say, well, maybe if we just all start eating a ton of chocolate, we'll just produce a bunch of Nobel laureates, right? So that's the idea of a cause and effect conclusion when you see a relationship whereas there is likely some other things that are causing this actual relationship that we are not, a lot of times we don't even know what these underlying relationships or confounding variables are. Here's another one that's a little bit clearer. We have the number of televisions per 1,000 people in quite a few different countries, and then the life expectancy in that country. So we see this quite fairly positive and strong, it's not linear, but a pretty strong relationship between the number of TVs that we have and the life expectancy. So again, we could say, well, we'll just start, sending people televisions, that the televisions are causing the life expectancy to go up. Well, of course, we know that that's not the case, right? That there are underlying reasons why that these number of televisions are associated with life expectancy, right? And so that's why we cannot make cause and effect conclusions just with associations that we find in observational studies, because there could be all of these underlying effects that are actually causing the relationship that we're seeing. So, for in this one, we might say, well, that it could be that it's socioeconomic status that's actually affecting both of these variables in the same way, and that could potentially be the underlying cause. Okay, and so that's the importance of why we want to have an experiment, is so that we can eliminate the potential for these confounding variables that could otherwise be causing the relationship that we're seeing. And there are lots of methods in epidemiological analyses that we can use to try and account for these confounders. So that's why we always include all of these demographics in all of our studies to try and account for these potential confounders. But it's, we can never be sure that we've accounted for everything. So again, causation from experiments. So we want to assign these subjects to our treatments so that the only systematic difference between the groups is the explanatory variable. There's nothing else. That's the only difference. And then we can say that the difference that we're seeing is due to the effect of the explanatory variable that we have. Okay, so this is the article on the primary prevention of cardiovascular disease with the Mediterranean diet. And when I used to use this in my intro stat class all the time because I thought it was such a nice experiment to share. And then I looked it up last year and it had been retracted. And it turned out that they had gone back and realized that some of these people did not perfectly adhere to one of the Mediterranean diets. And so they felt that they had to retract their findings, and that they were, and so that, and it's all because of these confounding variables, that it could be something else due to, that was causing the difference in cardiovascular events that they were seeing. Yeah, I just got a comment there to everyone that it's brave to retract an article. I absolutely agree. I think it's quite amazing that, in such a big article that they brought that to our attention and brought in. And I think it's still a really useful finding and experiment, but really important that the non-findings are published along with the findings, and that we acknowledge our errors. Okay, so diagramming this study, I think that diagramming studies can be really, really helpful in your design and then also when you're doing your modeling. There are these things called directed acyclic graphs. They're called DAGs. And when in doubt, just always draw a picture and really try and get a sense of what's happening. So in this study, there were these 7,447 subjects. They're randomly assigned to one of these three groups. And this is what we would call the explanatory variable. And that explanatory variable has one of three levels. So you just get one of the three levels. And then at the end, you come through and compare these rates of cardiovascular events between those three groups. And, there are studies that are much more involved in this. And then there are those diagrams that help you understand even some potential confounders in observational studies as well, which are really nice to draw for yourself. Here's a diagram for the smoking, right? So we have subjects who are smoking or don't smoke, and then compare cancer rates. But of course, there's no random assignment. So could there be other things that are associated with smoking and not smoking that are going to confound our ability to, you know, to make this conclusion about smoking causing lung cancer? And this is why it took so long for researchers to really be able to definitively say that. But here's what we can do when experiments are not possible. How do we do that? Well, there's a strong case for cause and effect if we can do a little bit more work. In the absence of being able to conduct a gold standard randomized controlled trial, we can look at a few different things and combine information from multiple studies. So if we have the consistency of the association across many studies, both prospective and retrospective. So prospective means looking back into the past once we know someone gets cancer. Prospective is looking into the future, excuse me. So we would say, you know, we know these people are smoking, let's follow them into the future. Retrospective would be, we know what the outcome is, let's look back into the past, into their history. The retrospective have problems just because of problems with recall and other, and just it's hard to have extremely accurate information there. The strength of the association, the existence of this dose response, that is, if the more someone smoked, the more likely they were to develop cancer. This existence of a temporal relationship, that is, that smoking almost always preceded the effect of lung cancer, supporting evidence from controlled experiments with animals, and then also a plausible biological mechanism that was established from biochemical studies. So, you know, you can make these cause and effect arguments when you have a lot more information able to pull these things together that can be pulled together to actually establish cause and effect relationship, which is what the US Surgeon General then did conclude, since we had all of these as well. Okay. So the one thing with experiments is the scope of interest. Experiments are usually not conducted on, we've spent all this time on randomization and sampling and saying like, well, we want to have a population or a sample that's representative of our population. Well, in reality, experiments are not going to be conducted on a random sample of individuals. So even if we can say, smoking caused lung cancer in this group, or we can, even if we can say, you know, with an experiment that this diet reduced cardiovascular events, we have to be careful about the scope of inference, because maybe our experiment was only done on people who were between 50 and 70, white males who were only between 50 and 70 years old. So then we have to be really cautious about the conclusions that we make. Okay, even though it was a controlled experiment, we can say that the diet caused the reduction in heart disease or cardiovascular events. You know, we just have to be cautious about how grand we make that conclusion based on who the participants in our experiment are or were. And so then that goes back to the research design. How are we going to choose the people in order to make the conclusions that we want to make? Okay, and often if we observe a difference in response or outcome values between the treatment and placebo groups, how are we going to make a decision about, you know, if we go back to these numbers here, all the way back, you know, when is 109 different from 83, or is it just random chance? You know, is that a big enough difference for us to say, yes, this diet is reducing the likelihood of cardiovascular events? And so that's where we go into statistical inference to try and get help in making that decision. So looking back at some of our historical examples, Florence Nightingale observed the connection between unsanitary living conditions and unnecessary deaths. She just conducted basically a observational study, taking data from whatever she could gather, and made this connection. The researchers that fought hard to make the polio vaccine, they were going to just do an observational study, and they fought hard to do a controlled experiment where they did actually assign a placebo and a polio group. And then they, of course, allowed the polio vaccination later, but they actually did a controlled experiment to get a placebo vaccine in there. And James Lind has a lot of these experimental features incorporated in his study. And then this COVID vaccine 19 study, they have already been shown to be effective based on experimental design. And then this latest college study is also, they have a control group and they have a vaccination group, and then they're comparing, these nasal swabs taken every single day, and then in addition to the COVID tests. So this is another, very carefully designed study to try and follow the transfer or the transmission or lack thereof of COVID-19, and had to think really thoroughly about how to design that. Okay, so lastly, we're gonna, as I promised, we're gonna just talk a little bit about, well, how do I know when 83 versus 100 is a big enough difference to say that there's actually a difference? And that's the final frontier here that we want to look into. And it'll just take me a sec. Stop share. Okay, so I have one last video to share with you, and this is about Parkinson's disease. And I'll just, without explaining it, this is just the way that I'm going to start introducing statistical inference procedures. And so I'll share this with you, and then we'll do a follow-up on it.
Flowers, fumes, coffee. For most of us, smells are simply part of everyday life. Not for Joy Mill.
Oh, thank you.
This grandmother from Scotland has such a sensitive nose, she can smell disease. An incredible ability, verified and published in scientific journals, where she's known as the super smeller.
It's somewhere between a dog and a human. And I take that as a compliment.
Joy, a nurse, says she's always smelled changes in her patients, but it was a change in her husband Les, a doctor, that would alter both of their lives.
He was only 31, just going on 32. It was that summer.
Les didn't smell like himself, and the odor wouldn't go away.
I thought, well, I'm not going to nag about this.
More than a decade later, at 45, Les was diagnosed with Parkinson's. The disease actor Michael J. Fox has battled for years. Muhammad Ali had it too. It causes tremors and eventually dementia. At Les's very first support group meeting, Joy's nose was overwhelmed.
And I said, look, everybody else in that room with Parkinson's has the same smell as you. And he just went, what? What on earth are you talking about?
University of Manchester biotechnology professor Perdita Barron was skeptical. So she and a team of researchers tested Joy, not with high-tech machines, but T-shirts.
Well, we got some people with Parkinson's, 6 people, and 6 people who didn't have Parkinson's, and we bought them identical T-shirts and they wore them overnight.
They gave the shirts to Joy, and she sniffed out all of the Parkinson's patients, plus 1 T-shirt in the control group. 9 months later, that person was told he had Parkinson's.
That was really transformative. Now, some other person had it before they were clinically diagnosed.
Once symptoms like tremors start, the damage to the brain is already irreversible. Joy could be the key to catching it early.
So what does Parkinson's smell like?
It's a very musky, thick, greasy odour. It's not pleasant.
But a lot of scents make her smile. She tried to teach me how to really stop and smell the flowers.
I can definitely smell the floral on the blossom.
Never just smell once, because smells are not one smell.
So now you're smelling
The chlorophyll, the basic molecules.
molecule.
Yes,
She smells molecules from people, too.
that's the cardboard smell.
With Joy's help, researchers pinpointed the Parkinson's smell to sebum, the oily substance in the skin, and identified molecules specific to the disease. The result, a groundbreaking new test.
We can tell within about half an hour from a patient sample, just a swab, whether someone has Parkinson's or not.
That test is still in early trials, but if it works, it could save countless families from the pain Joy and Les went through. He died 4 years ago.
What do you think he
would
think about what's happening
I keep
now?
on saying to people who ask me that, it's the tearjerker. No, he would be just over the moon.
An extraordinary ability that one day might lead to a cure.
Okay, so just a really fascinating story, but to kind of tie it all together with statistical inference, we're going to use the idea of how they tested Joy with these 12 t-shirts to really understand the idea behind hypothesis testing and a p-value in kind of its simplest form, to try and get this idea of what a p-value really represents. So in hypothesis testing, we have a null hypothesis and an alternative hypothesis. So the null hypothesis is, representing the status quo, nothing unusual, and the alternative is the theory that's being tested. So for Joy's case, let's say that we're interested in learning if we tested her, infinitely many times with these t-shirts, what's the proportion of times she would correctly identify a t-shirt as being either Parkinson's or not, but that it's a correctly identified t-shirt. So that's going to be our long run proportion of times that she's correct. So if she's just guessing every time she gets a t-shirt, then that proportion should just be 50%. Okay, so that would be the null hypothesis. She's at 50%, that's the status quo. The alternative hypothesis would be P is greater than 0.5. She's doing better than just guessing, okay? And we might even need more assurance that she's doing better than just guessing, to be able to go through and develop a test like they were talking about in that news article. But for us, let's just say we want to know that she's statistically significantly doing better than just guessing. So recall that she was given 12 t-shirts and she correctly identified the disease status of all 12. Well, she did the 11, but then that other person ended up developing Parkinson's as well. So could she have just by chance guessed 12 all correctly? So we want to, so the central limit theorem can help us understand this and help us get a p-value. But it's sometimes easier to just understand what's going on with simulation. Okay, so what we do with hypothesis testing is we assume the null hypothesis is true. So we say, let's assume she's just guessing. And, with a simulation, give her 12 t-shirts a bunch of different times. If she's just guessing, how many times on average will she be correct? Okay. And so I went and just simulated this using random.org with 50 different trials of 12 t-shirts each. So for example, the first time my simulation said that Joy got 8 correct. Then the next one, 6 correct, 8 correct, 5 correct, and so on. So you can see all of the different outcomes, okay? But none of them are even close to 12, right? We didn't even get up to 9, okay? So if she's just guessing, in 50 trials, she never even got above 8. So 9 or above was never even happened, okay? Well, in a p-value is the probability of observing a sample result. So in her case, we got 12. She got 12 correct. So what's the chance if she's just guessing based on our simulation, the chance that she could get 12 correct based on our simulation is 0. There's no chance that she got 12 correct if she's just guessing based on our simulation. Does that make sense? So that probability is the p-value. So the smaller the p-value, the more evidence we have in favor of Joy doing better than just guessing. So the more and more unlikely it is that we could have observed what we did just by chance, then if it's really unlikely that that could have happened, then it's giving us evidence that, well, then she's not just guessing, right? She's doing better than just guessing. There's something else that's causing her to make these correct decisions. Okay, and so that's the premise behind a p-value. It's the probability of observing the sample result if the null hypothesis really is true, basically is in the nutshell what is happening. So there are general guidelines that we can use if you like. I mean, different p-values can be interpreted differently in different studies depending on different scenarios. But in general, this is kind of a guideline that we can use. A p-value that's greater than 0.1, usually we would say it's really not giving us any evidence in favor of the alternative hypothesis. P-value between 0.05 and 0.1 says, well, there's really not that much, but maybe some suggestive evidence in favor of HA, of the alternative hypothesis. In the scientific community, we seem to be so focused on this 0.05 cutoff, and which is, we'll talk a little bit more about that in just a second. But we can say 0.01 to 0.05, there's moderate evidence in favor of the alternative hypothesis, but a lot of people shoot for that 0.05. 0.01 to, or 0.001 to 0.01 would be strong, and less than 0.001 would be very strong evidence. And so, like I said down here in the star, or in this, that a lot of people use this 0.05 and they'll just say significant at the 0.05 level, or they might have something that's significant at the 0.01 level, and that just means that their p-value is less than, say, 0.05 or 0.01, and they're just really looking for those p-values to go below that cutoff. So with such a small p-value, so what we would conclude for Joy, we have overwhelming evidence that the proportion of times Joy can correctly identify Parkinson's disease from a t-shirt is greater than 50%. That's all that we are saying right now. We just have overwhelming evidence about that, that she is doing better than just guessing. Let's see here. But how well did she do? Aside from our p-value, our conclusion doesn't fully address just how well she did. So now there's this movement, p-values are, I think they're here to stay, and hypothesis tests are still extremely important. But especially in many fields, especially in public health, we're really moving toward a focus on confidence intervals as opposed to just being so focused on p-values, because the confidence interval really allows you to get a sense of how much better is she doing than just guessing. Because just by saying the p-value is 0 for 50%, that's not saying just how well she did. And so we should be we can even give more information to our reader that, she's doing nearly perfect on these. And that gives more information than just the p-value. So recall that we have Gallup poll, and they give the results with a margin of error for a 95% confidence interval. Based on their sample, and then they do this plus or minus a certain number of percentage points, and they give it at the 95% confidence level. So they're using the central limit theorem to create, instead of just a hypothesis test, they're creating a confidence interval for where they think that value actually is. So a confidence interval is calculated by getting your sample, you know, whatever your sample statistic is, whether it's a sample proportion or a sample mean, and then you're adding and subtracting this margin of error that you get based on that central limit theorem and this idea of a sampling distribution. And that comes from your statistical software. And, you know, I would encourage you, if you're going to be doing a lot of this, that you delve more deeply into better understanding where that's coming from. But for now, just understanding this basic idea of how these are composed is good. So this margin of error is a combination of this critical value, which tells you how much confidence you want. So the bigger the critical value, the wider your confidence interval, but then also gives you more confidence. And then the standard error tells you how much variability you would expect in your sampling distribution based on your sample size and other characteristics. So for example, in the COVID-19 example, the sample statistic was 0.14, the margin of error was 0.02, and so 0.14 plus or minus 0.02 is the confidence interval 0.12 to 0.16. So we would say then that we are 95% confident that between 12% and 16% of people living in the United States might not seek healthcare due to cost if they experience COVID-19 symptoms. And so I'm just understanding this basic framework of how these confidence intervals are put together, I think is a really nice way of just learning how to consume some of these intervals that you'll see in a lot of papers. And knowing that these margin of errors are just a function of those sampling distributions that usually come from the central limit theorem and the normal distribution. Okay, so here's the crux. When I say I am 95% confident, what does that actually mean to be 95% confident? Well, the best way that I know of to explain this is through yet another simulation, because I think it's really helpful. So let's suppose, you know, in a perfect world, we never know what we never know what the population proportion is. But let's say in a perfect world that we have the ability to know what that is. So that's going to be represented by this line, that 0.15. That's the true proportion of people who would go seek medical, or would not go seek medical care. Recall that the sample proportion from Gallup was 0.14. Okay, so let's assume that let's just take random samples. Let's focus on this first one up here. I take a random sample from my population of all US adults where 15% would not go seek medical care with COVID symptoms. And I get a sample proportion of around 0.14. So then I use my margin of error to get the lower bound of that interval and then the upper bound of that interval. And look, it captures 0.15. So in that case, that interval contains the true proportion, okay? Then on the next one, I get a different sample proportion. Remember, this is just a simulation. So I take a different random sample of size 1017. I get a different confidence interval. It's slightly different, but it still contains 0.15. And I keep going down, 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 down. All the intervals, they're moving around a little bit. They're ranging, you know, some of them go all the way down to, you know, 0.11 or 0.10. Some of them go all the way up to 0.18 or 0.19 or maybe even close to 0.2. But in general, you know, they're pretty concentrated and almost all of them contain the true proportion of 0.15. Notice that I have this one and this one think those are the only two. So in this simulation of 100 confidence intervals, I captured the true P, the true proportion, 98% of the time. And that's what 95% confidence means. It means that in repeated sampling, if I continually took the sample of the same size at random, as long as it's unbiased and representative of the population, that 95% of the time, I will capture that true proportion. That's what 95% confidence means. Okay, and so that's and that's again based on the central limit theorem. And I feel like that's a really nice illustration to help you understand what that actually means. So you could be missing it, but 95% of the time in repeated sampling, you will capture that true proportion. Are there any questions about that? Okay, I'm having let's see here. Okay, great. I just want to make sure that nothing else is in the chat. Okay, so confidence intervals. So we're focusing on, so we went through statistical significance, confidence intervals, and now I just have a couple of other things that I want to talk to you about, and then we'll kind of pull everything together here. So back to this Mediterranean diet example, researchers found a p-value of 0.009 when they were looking at the difference between the rate of cardiac events in Mediterranean and olive oil versus the control diet. So that means that there is a very low chance that the differences they saw could be due to just chance alone. Okay, that there is potentially a difference between the two in terms of the cardiac events. Okay. And assuming, this article was retracted, so we have to be careful with what we say because it turns out that the experimental design was not what we thought. But assuming, let's just hypothetically say that it is a well-designed controlled experiment, with that p-value, with such a small p-value, and we can say that there's likely a significant difference between heart rates for the Mediterranean diet versus the control diet, and that the Mediterranean diet is causing the difference in the cardiac events, and it's because it was a randomized controlled experiment, that there's likely not any confounding variables. Okay, so if this was just an observational study, we wouldn't be able to say that cause. We could say there's still a statistically significant difference between the two groups, but there could also be something else like socioeconomic status or something else that's actually causing that potential difference in the cardiac events. Does that make sense? Let me know if anybody has any questions about that. Okay. So there's a study, I just want to talk about, we don't have time to go into a large detail, but I want to talk about the difference between relative risk versus percentage point difference or increase. Because I think that it can be quite confusing when you're first starting to read some of these public health publications. To know how the difference in when we're talking about relative risk versus just a difference in percentages. So there was a study on air pollution and COVID-19 death rate, and their conclusion, in quotes from the paper that was from the Harvard T.H. Chan School of Public Health, says that we found an increase of only 1 unit in particulate matter at the 2.5 micron level. That if we increase that by 1, it's associated with an 8% increase in the COVID-19 death rate. And it says that these results were statistically significant and robust to secondary analysis. So you know, we're gonna just assume that we can't know for sure what the death rate was before and after based on how they presented the model in their research. But let's just suppose that the death rate for the group with the lower PM 2.5 is 1.3%. Then based on that model, the death rate for the higher PM 2.5 level would simply be 0.013 times 1.08. That would be an 8% increase from 0.013. So the new death rate would be 0.014 or 1.4%. Okay, so that's an 8% higher death rate when you're talking about percent change for people in areas with higher PM 2.5 than for those with lower PM 2.5 on average. Okay, but when you're looking at the absolute difference, right, just the percentage point increase, that 0.014 minus 0.013 is just 0.001 or 0.1%. And I just feel like that's a very large difference. And it's just nice for us to be able to understand when we're talking about this percentage point increase and when we're talking about a percent increase. And so I've found in that to actually use the term percentage point really helps to make that point to people that no, this is a percentage point difference, not a percent increase or a relative risk calculation. Both are very informative and used widely, but sometimes I think they get confused because they do have quite different do have quite different conclusions. Okay, a couple other points. So modeling, statistical modeling is used widely throughout public health. And it's this idea that we attempt to mimic reality with a mathematical representation of a given process or relationship. But one thing to keep in mind is that all models are wrong, but some are useful. It's a famous quote by George Box that, you know, models can be extremely useful, but we also have to take them with a grain of salt, that they still are only models and that they have a lot of assumptions to be made, underlying assumptions, and that we can't use them for extrapolation as well, and we have to understand their limits. So we just need to educate ourselves about how to use them and what they're actually doing. So this is one of my favorite data sets. It just looks at brain weights and body weights of 62 species of land mammals. And because there are some really large body weight and brain weights, but mostly smaller, we can use a log transformation to kind of even out the distribution a little bit and linearize their distribution a little bit, or the relationship a little bit. So we can take the log transform of both the body weight and brain weight and look at this nice, pretty linear relationship here. And so we can come up with a mathematical model. And, you know, we can be statistical modelers, and it's really, you know, this is the simplest and most useful form in statistics, in my opinion, is just the simple linear regression model, where we attempt to use the simplest technique if possible. And so we're just looking at this nice linear relationship between the log body weight and log brain weight. And so then we can attempt to describe with this one succinct equation how these two measurements are related to one another without having all of these messy data. But it's just a model, right? We have all of this variability on either side. It's not perfect, but it does allow us to describe that relationship. So if I add another animal into here that has a log body weight of 2, then I can predict based on this linear equation, I can then predict what that brain weight will be. And it's a very useful technique. And I can also add confidence limits on that as well, since there is variability here and we can add confidence intervals onto those estimates. Okay, So another thing about modeling, this 538.com is one I really enjoy reading some of their articles and some of their polls, or their consolidation of polls. But this kind of shows you why modeling can be so difficult if you're trying to pinpoint every single different characteristic variable that could potentially affect your outcome. And I just felt like this was a nice illustration as to, for, you know, a lot of times we can get away with modeling where we really can we can take just 1, 2, 3 variables, and, you know, it's not going to be perfect, but it gets the overall amount of variability that we need to be able to make decent predictions or basic conclusions. But, you know, a lot of times when we're really trying to make these big predictions, you know, there's so many variables to think of, and there's, you know, all of these loops happening everywhere, that it can just be really difficult to come up with good predictive models, because all of these different variables are constantly changing and affecting each other in different ways. So I just thought that that was kind of a nice illustration as to why modeling can sometimes be so challenging. So just some final thoughts in conclusions here. So we've covered some basic and important statistical concepts that allow us to feel empowered, hopefully that you're coming away feeling empowered with ways to organize, collect, and analyze data in terms of just exploratory analyses, such as graphs, charts, and then also thinking about different sampling techniques and the importance of considering different types of biases, the importance of including randomness into your procedures, the different types of studies that can be used, such as observational studies and experiments, retrospective, prospective, and the types of conclusions that can be made based on, you know, what your population of interest is, whether you have a controlled experiment, how many different studies you are, you know, combining to make a, you know, if you're thinking about trying to do a meta-analysis, which would mean combining different results from different studies to try and make more causational conclusions. And then we just hit the tip of the iceberg with statistical inference. But I think that if you can, you know, I know that we all have different levels of familiarity with statistical inference, but I think it can sometimes be more intimidating than it needs to be. So if you can get this overall idea, in my mind, that the biggest concept you can try and grasp is this idea of a sampling distribution, so that you can understand this idea of getting the notion of sampling variability under the null hypothesis, or assuming the null hypothesis is true, to then assess the significance of your result. I think that's the biggest thing to be able to put together in order to be able to understand what those p-values represent, but then also knowing that those p-values are not the final say, and that the confidence intervals are usually going to give you the most information, or the most respected piece of information in your results, and that lend themselves to being the most interpretable. So you can really give, you know, your reader or yourself the most information by giving the confidence intervals. And the confidence interval already tells you that whether your hypothesis test is significant or not, based on where it is. So I would just urge you to focus more on those rather than the p-values. But the p-values are still very sought after throughout the scientific and world of public health. But I would love to, we still have about 10 minutes. If there are any questions or points that you'd like me to talk about or go over, or if any of you want to just like yeah, just bring up any issues that you'd like to talk about as public health professionals in how that relates to what you're dealing with in your quest towards statistical literacy. That would be great if you want to chime in and either chat or talk.
Hey Cindy, it's Alexis. I just wanted to let everyone know I also went ahead and put a survey where everyone can provide feedback on this training into the chat box. Y'all can just take a couple minutes. It really does help us to inform and improve future training.
Great. Thank you, Alexis. Yeah, if anybody wants to chime in or say anything or ask any questions, feel free to unmute. And if not, that's totally fine too. But we'd love for you to take that survey if you don't have any questions.
Since no one's talking, I'll contribute an example that we went over in my graduate coursework like 10 years ago about the practical uses of research in health and social services. So I don't know if y'all remember Rob Blagojevich, who's the governor of Illinois that went to jail for selling or trying to sell Senator Obama's seat. So apparently when he was governor, he had read some research study that associated the number of books in a child's home with an increase in early literacy skills prior to kindergarten entry. So he had proposed a $26 million budget to get every child under 5 one book a month mailed to their house. But obviously, like, the caveat there is that the proxy, like the number of books in a child's home, is really just a proxy for parents' level of education and income. It doesn't guarantee that parents are going to sit down and read to their children. So anyway, just kind of I always like that example as a research in action, like of do not do this, of being really careful of those like confounding factors and not immediately establishing causality between associated variables, because it could mean anything. Like that chocolate example was also great. Yeah.
Right. No, yeah, thank you for that. It's so easy to do, you know, just our minds just so want those causational relationships and being able to just jump in and have these actions. But yeah, it's that's a nice example. Thank you for sharing.